Prepare to have your health questions answered here on Safe, Effective Natural Solutions with Dr. Todd Binkley, owner of Binkley Healing Center in downtown Ventura. Now, here's Dr. Todd.
Good afternoon. I'm Dr. Todd Binkley, board-certified doctor of non-force chiropractic and practitioner of functional medicine. The focus of today's talk is going to be about high blood pressure. Most people don't check their blood pressure often enough, and high blood pressure is a silent killer. If you want to be proactive and protect your health, and you're over 40 or 50, or you have any significant stress in your life, even if you have no symptoms, you should check your blood pressure periodically, and I'm going to talk a lot about that today. I'll talk about some patients that I've helped reduce their blood pressure without medication, and why it's important to take medication if your blood pressure remains high and nothing else you're doing is getting it down. So, really important subject. I'm excited to talk about it today. And if you have questions about that, please email me at Dr. Binkley at binkleyhealingcenter.com. You can also listen to all of the past episodes of this show. This is episode 49. We're coming up on a year that this program has been on KDAR 98.3 FM. This is episode 49, so there's 48 past episodes available on my website, binkleyhealingcenter.com. If you have an iPhone or an iPad and like to use Apple Podcasts, it's available there, Safe, Effective Natural Solutions, or just put in my name, it'll come up. Also Spotify and YouTube. So check out those back episodes. And if you like what you hear, please scroll to the bottom and like the podcast. That encourages other people to check it out and hopefully influence more people to make healthier choices for their lives. That's the reason I do this show. Appreciate you listening, and I love questions. Send your questions to me about high blood pressure or any other health-related topic, and I can discuss it on the air, or I can just respond to your message and answer your questions privately. So before we get into the blood pressure conversation, here's another major benefit of doing testing with me. I was just reading I spend, 20 or 30 hours every week reviewing medical literature. I get inundated with all of it just comes, you used to have to spend hundreds of dollars a month subscribing, paid monthly subscriptions to various medical journals, depending on your specialty, to get all the latest research. And so the one thing that's nice is it all comes, it's emailed out to most doctors now through portals like Medscape and MedPage and others. Not WebMD. WebMD is a patient-based website that's mostly pharmaceutical marketing. It's not the best source of information. If you're Googling, if you want to look up information about a condition and you want to look up information online, I always recommend that you check out sites like the Cleveland Health Clinic or Harvard Medical News. And then, of course, all the real research is at PubMed. That's usually a little bit more difficult to read for a layperson. And, of course, ask me, send me your questions. But anyway, a major benefit of getting testing done at my office is I'm not connected to the electronic health record system. So I was reading an article about other doctors lamenting that, most doctors hate the time it takes to input all of your information into the electronic health record system. And, it is important. It's great that it exists. It's important that if you go to Dr. A over here, say you go to the emergency room, and then later you return to your regular doctor, maybe in a different state if you're on vacation or just for whatever reason. And if you've had emergency care or medications that could interact with something some other doctor may prescribe, it's a great thing that doctors can look up and see what other meds you're on. So the main reason that the electronic health record system is a good thing is because if you're taking toxic, potentially, life-altering medications that have strong interactions with each other and with things that you may eat or a whole host of other things. It's important for any doctor who's treating you to know everything that you've done recently, and sometimes patients come in and they don't remember what happened or what that other doctor did, what tests they did, etc., so they can access it. So that's a good thing generally, in principle. But this article was about how a lot of times you get the electronic health record, and depending on who entered the data at the other end, it can be next to useless. He was describing a patient that went to emergency room, and the data that had been entered by that emergency room was basically useless. It didn't really give that doctor any kind of appreciation for what treatment and testing that patient received in the ER. And then he gave an opposite example where, like you see in the movies, if you ever watch shows about attorneys where they do a data dump and you get boxfuls, you request the data on someone and you get people come in with hand carts full of stacks of boxes of medical records. Anyways, he had another patient requested the medical records, and it was 3 or 4 boxfuls, 42 inches high stack of paper that was just impossible to weed through and also get any useful information from. So that was a little bit of a tangent, but my point is sometimes you may want to get some testing done to find out how things are going with your health, and you may not want anybody else to know about it, or at least not right now, maybe later. So when you order tests in my office, no one else has access to them without your permission. So one recurring benefit of this, for example, is people who need to qualify for life insurance. If your cholesterol is high, life insurances vary. They check your cholesterol, they want to know your blood pressure, your age, your weight, your BMI, some of the criteria. Those are the most important ones. Some companies require other things. But the point is, if you're going to apply for life insurance and maybe you've been speaking to your advisor and you're wondering if you're going to qualify, it can be very expensive. Especially if you're a man over 50 and you have, any test finding that shows that you're at increased risk of heart disease, diabetes, etc. And so I've had many patients who have been in that situation, have come in, and maybe their cholesterol is a little bit elevated, or maybe they do have pre-diabetes or some early signs of liver or kidney disease. And we put them on some better food, a little bit of exercise if they do it, or oftentimes just some supplements. Many, many times just give them a few supplements to flood their river of life that courses throughout their body, give it all the nutrients needed for your kidneys, your heart, your liver, your immune system to start working better. Cholesterol is mostly controlled by your liver. And, 3 or 4 months later, it goes back to normal. Then you take that test in, or you go to the insurance company, however they want to do it, and get that test done and qualify for the lowest rate. Another common example is maybe you want to know what's going on with you and you don't want your family to worry about it. So this one doesn't come up that often. I just thought of it as another example. I usually recommend that patients include their family once they know what's going on, if it's something important, and they usually do. But for some, it's nice to know, even if their spouse or their brother or their daughter is a doctor, there is often a way to enable you to get information and a proper diagnosis and treatment recommendations before you choose. You have that choice to share the information with others. So, blood pressure. Some important studies have come out in the medical literature about potassium. We hear all the time about, if you're going to control your blood pressure, you need to not eat too much salt. But what they don't tell you is that what really matters is not your total sodium intake, but your sodium-potassium balance. Sodium and potassium are both essential nutrients. You couldn't survive without them. And what really matters is keeping sodium and potassium in balance. I'm Dr. Todd Binkley. You're listening to Safe, Effective, Natural Solutions to Almost Any Health Challenge. We're talking about high blood pressure today and how you can control it safely and effectively with natural means wherever possible. But we're also going to talk about the importance of just making sure you know whether or not your blood pressure is high or not. So you usually don't hear much about the importance of potassium. But for example, if you've ever, or you know anybody that's had heart surgery, many doctors recommend supplementing potassium to a high normal level after heart bypass surgery. This is an article that came out, that was reported in the European Society of Cardiology, counteracting or pushing back against this widespread practice of routinely or sometimes even aggressively supplementing potassium to achieve this high normal level. This is reported by Benjamin O'Brien, MD, PhD, of a university that I can't pronounce in Berlin. They reported at the European Society of Cardiology. And basically, they showed that this tight control of potassium is often unnecessary and is based on no solid evidence, and sometimes can even have cause problems. So, too much of a good thing is never good, and it's a little too technical to go into the details. But I was surprised to see that study came out, because it's really common to recommend potassium. Potassium supplements are regulated usually to be no more than 99 milligrams, because taking more than that can be problematic. The bigger picture is, which we're going to come back to in more detail in a minute, is you can get all the potassium you need from food. All vegetables have potassium in them. So by contrast, there's another study that came out from the European Society of Cardiology updating their treatment guidelines for hypertension, for high blood pressure. So high blood pressure has, for decades, been defined as 140/90 or above. So the systolic, top number, 140, bottom number, diastolic, over 90. Normal blood pressure is 120/80. High blood pressure has long been considered to be 140/90. Well, for several years now, they've been lowering that upper number. The top number has been increasingly recommended to be lowered to 130. So pretty much the working, it's not completely official yet, but many places, at least cardiologists are recommending in America and in Europe, that you really think more of treating high blood pressure to 130/90. And again, so normal is 120/80. But these guidelines in the European Society of Cardiology's most recent presentations, based on the review of boatloads of data, are recommending that the new guideline be for a blood pressure goal of 120 to 129, which is basically saying less than 130, but also for the bottom number to be 70 to 90. I've never seen that before, and I haven't been able to find the data that they based it on yet, but they're even saying that the bottom number should be 70 or below. I'm not sure how important that is, but the things that were exciting about it to me is they've established three categories. Instead of just normal blood pressure, 120/80, or high blood pressure, 140/90, or maybe 130/90, they're establishing a third level called elevated, not high, but elevated blood pressure. So they're saying now normal is 120/70, elevated is 120 to 139 over 70 to 90, and then the usual hypertension 140/90. But they also emphasize, this is one of the best parts, they emphasize that out of a doctor's office, blood pressure measurement is very important. They're stressing that the guidelines for that are much stronger than in previous guidelines, because everyone has heard of the white coat syndrome. You go to the doctor's office and your blood pressure is elevated because you're in a doctor's office. Maybe you're in an unfamiliar situation, or you're worried about having to start taking more meds, or a whole host of reasons people's pressure goes up when they're in a doctor's office. So it's a really good idea for many people. Again, almost anybody over 50, say, or anyone who has high stress in their life. And when I have conversations with patients, they say, "Oh, I don't have any stress." Well, your blood pressure's off the charts. You tell me that you can't sleep, and you have anxiety, and you have a whole host of other things, but they don't experience. So if you don't like the word stress, if you think that you don't have stress, but you have anxiety, you can't sleep, you get angry, you have tight muscles, you have symptoms like this, you have stress. Just pick a different word if you don't like the word stress, but those are all signs of stress. If you have any of those things, you should be checking your blood pressure at least once a month, and if it's high, every day for a few weeks, a couple of weeks. When your blood pressure is elevated, one reading doesn't mean anything. You have to check it a few more times and get a pattern. And the best way, if it is high, so that you don't freak out, the most important thing to do is check it every day, a couple of times a day at least, for a week, and then average those numbers. So write all the readings down for at least a week, add them all up and divide by the number of entries to get the average. And that average over a week is a much better indicator of your risk from the damaging effects of high blood pressure than any individual reading. Another thing that was really exciting in this updated guidelines for the European guidelines for high blood pressure treatment is that they introduced a new recommendation for lifestyle options to help lower blood pressure, including changes to exercise advice and the addition of potassium supplementation. So I just mentioned that sometimes potassium supplementation is not so great. So they do qualify this by, among other things, recommending that you get the potassium not from a quote-unquote supplement, but from food. But they also suggest that people in this new elevated, middle-of-the-road blood pressure category, not too high, not too low, but elevated, again, by definition, 120 to 139 over 70 to 89, they recommend that those people be subject to a risk stratification assessment before the treatment decision is made. So basically, before they just slap you on medication, write you a prescription, they check for certain things. So for example, people in the elevated blood pressure category, not high, but elevated, who also have moderate or severe chronic kidney disease or already have established cardiovascular disease, diabetes, hereditary hypercholesterol, hereditary high cholesterol, or for any other reason are considered at high increased risk for cardiovascular disease, then these patients are recommended to, after 3 months of lifestyle intervention, consider going on drugs. So that's the important part. After 3 months of lifestyle intervention, they recommend, so they recommend doing 3 months of lifestyle intervention before starting on drugs. That's not in the American recommendations. They give lip service to recommending lifestyle intervention, relaxation, better sleep, some of the things that I'm going to talk about here a little bit later. But in my experience, hardly anyone does it. And I don't know. I don't live in Europe. I don't know how many people in Europe are doing it either. But at least it's part of the recommendations. It's more strongly encouraged. The education, the research there generally always includes, much stronger support for, recommendations for doing something natural, healthy, better food, exercise, and supplements to address a situation that is easily treatable with that instead of just going straight to drugs. So that's always exciting. Here's another really exciting part of these new European recommendations that they insert certain caveats. So they suggest treating blood pressure to get it down to somewhere, the upper number, to somewhere between 120 and 129, basically below 130 instead of just below 140. But they also say that more lenient targets can be considered in people with orthostatic hypotension. That means if you stand up, you get dizzy. And this is huge because many, many people, I've had, countless patients who are on meds for blood pressure and they refuse to take them because when they stand up quickly, they get dizzy. And especially older patients, old people that were in their upper, 75 or older, 80s especially, your blood vessels get stiff. And if you're too aggressively treating blood pressure with drugs, that's one of the main reasons to control it naturally instead of with drugs, because the drugs can't respond as fast as you can stand up. So you get dizzy, and that's how you know. That's how you know, for example, if your blood pressure is too low. If you stand up quickly and you feel dizzy, your blood pressure is too low. And if you stand up quickly and you get dizzy and you're on blood pressure medication, you might be taking too much medication or the wrong medication, or you're a really good candidate who should consider better food, exercise, and supplements in addition to your medication. So these new European guidelines also suggest, not over-aggressively treating people to these new lower targets of 120 to 130 upper number for blood pressure if they're 85 years or older, or if they have moderate to severe frailty or a limited life expectancy. So, people that are in care homes or have some kind of chronic disease, there's no reason to overdo it with those people because it's not going to dramatically increase their lifespan. Interestingly, this same article quotes a physician at the University of Washington in Seattle, American College of Cardiology, saying, "These new European guidelines have thoughtfully used the latest study data to simplify recommendations and coordinate their guidelines to be more in line with U.S. guidelines. Well, they're not more in line with U.S. guidelines. They're better than the U.S. guidelines. The U.S. guidelines do not emphasize testing your own blood pressure at home, and they do not have this third classification of elevated blood pressure with the caveats that I just mentioned to avoid overtreating blood pressure with medication. I'm Dr. Todd Binkley. You're listening to Safe, Effective, Natural Solutions to Almost Any Health Challenge. We're talking about high blood pressure today, and it looks like I'm going to be doing a second episode on high blood pressure next week because we're going to run out of time before I get to all the stuff that I wanted to talk about today. But of paramount importance, something anyone can do, you can do, someone you know who has blood pressure can do to lower your blood pressure is deep breathing exercise. So lots of people talk about doing aerobic exercise, also very important. These European guidelines, for example, the last thing that was a change from the standard previous guidelines were 75 minutes of vigorous aerobic exercise per week is also an option, an alternative to the current recommendation of at least 2.5 hours per week of moderate intensity exercise. So that's important because for older people, the moderate exercise is going to be better to prevent injuries, prevent falls. So people just don't have the strength to do vigorous exercise. But for younger, high-stress people, that are less than 70, say, for example, or especially people that are in their 40s or 50s, but still have high blood pressure because of their lifestyle, they're going to benefit more from vigorous intensity exercise because they're going to get stuff out of their system. It just feels good. People, lots of people have just learned this from experience. So it's good to have it now codified into the recommendations for more people. But the goal of every functional medicine practitioner is to enable you to live long and live well without drugs. So I've seen thousands of patients personally with high blood pressure, and some of them want to get off of all their medications, including their blood pressure medications, and some of them don't. But I will never recommend that anyone stop taking blood pressure medication until their blood pressure is well controlled without it, number one, and they discuss their decision with their prescribing physician. So I often have people come in and say, I don't want to take any drugs. I want to get off all these medications. And, there's lots of ways to get off of certain medications. I still always recommend that they go and discuss that decision with whoever prescribed that medication. I didn't put you on any medication. It's not my job to take you off of that. That's your decision. You need to discuss it with that physician. But for example, I don't think anybody, almost no one, in my humble opinion, very few people need to take statin drugs, and very few people, in my opinion, should take or need to take, especially if they're willing to do the alternatives that work better. Very few people need to take osteoporosis drugs because those things are mostly bad, and there's just so many better alternatives that work better. But blood pressure medications are the great exception. If you have high blood pressure and you're not controlling it without medication, then you need to take the medication, maybe for the rest of your life. Or again, if there's other ways to get your blood pressure down without medication, for many people, but not everyone. Some people, if you're over 80 especially, it can be very difficult. I've had patients who've had high blood pressure for 30 years in their 80s get off of medication by controlling it with better food, exercise, and supplements, but they're the rarity. So unless you do something, and I'd be happy to do the proper testing to identify a way for you or someone you love to reduce their need for medication, because it's also good most people end up on 3 or sometimes 4 medications just for blood pressure. They're on lisinopril and hydrochlorothiazide and maybe a beta blocker or, something else. There's so many different drugs to control blood pressure. There are ways to reduce your dependency on pharmaceuticals, even if you still need to maybe just take one of them at a lower dose. And that's a good idea for a lot of people. As long as you make that decision with proper documentation, check your blood pressure at home. So I'm going to talk, tune back in next week. I'm going to talk and do a whole other episode on blood pressure because there's so much more material to go over, including getting a good blood pressure cuff to use at home. So thank you for listening. Tune in next Friday for more information about high blood pressure and a safe, effective, natural solution to eliminate it. Have a fantastic weekend.
You've been listening to Safe, Effective, Natural Solutions with Dr. Todd Binkley. If you have a health question you want discussed on the show, email your health questions to Dr. Binkley at binkleyhealingcenter.com. Take advantage of this opportunity to ask questions for yourself and for your loved ones because our health matters. Join him next Friday at 4 p.m. for Safe, Effective Natural Solutions, right here on 98.3 The Word, KDAR.